So my name is Richard Andrews. I'm the founder and CEO of Healios, and it's a real pleasure to be here this morning to talk to you about our journey at bringing innovations within the mental health space. And it's going to be a double act today. I'm with Dr. Lars Hansen, who's the Chief Medical Officer at Healios and consultant psychiatrist. So where did this journey begin? Well, it began 6 years ago, where I had members of my family and friends who were impacted by mental health challenges to various degrees. And sadly, seeing them bounce around the system, not getting the help they needed when they needed it most, but also as a loved one, with our worries and concerns that we have of someone with mental health challenges, was really hard to accept. And so I decided to take a leap and start Healios. But I knew I needed to fix something, but I didn't know what needed to be fixed. And only apart from my own experiences with families and friends. So with the help of Lars, I got approved as a clinical observer in his trust and went into the homes of almost 100 people in the south of England who are impacted by severe mental illness, and that's psychosis, schizophrenia, schizoaffective disorder, and so on. And that was a very eye-opening experience for me, particularly as I didn't have any other experiences beyond family and friends. And to see severe mental illness devastate families, rip families apart, was a very heartbreaking moment. But it gave me a really good understanding of what I needed to fix. And that was that we had to solve the issue of access, but also we had to solve the issue of how do we bring the family together for the best impact at moving forward with mental health conditions. But not only that, what the experience also gave me was a lot more of an understanding of NHS mental health services in this country, which again I had very limited experience of. And during that journey of going into all those homes and accompanying clinical experts, I really got a great appreciation of this huge talented workforce within the NHS, but also the appreciation of how many external forces are working against that workforce. You know, not only is demand outstripping capacity and our workforce is overstretched and stressed in the delivery of care, but also the infrastructure in the delivery of care is forced between 9 to 5 days a week. And on top of that, we have things like bureaucracy that are preventing us delivering great services as well. So I had a really good understanding and appreciation of how this great, talented workforce out there is really up against it in the delivery of excellent care. And so the other thing that we wanted to solve is that whatever solutions we came up with, it just had to relieve the pressure on this great workforce. So what we wanted to do is to create a service that had a great experience. We really wanted to redefine the experience when it comes to accessing mental health services in this country. And at the outset, we decided to come up with some design principles around this to help guide us on this journey from day one. Those are things like, how do we create a service that could actually be fun? How do we create a service that's beautiful in its design, but is also very simple and intuitive, and perhaps can even inspire change? And these are often the words we don't associate really with any mental health service anywhere in the world. And we wanted to really redefine that and create this great experience. And we found if we did that right, then perhaps that can actually lead to better outcomes. Because if we can design services that have a great experience, maybe more people are likely to engage and stay with that for the full therapeutic benefit. But we had a big challenge when we started off. We had these design principles, we had this belief, we had this thing that we had to do something right to fix this problem. But we had a major challenge. How do we combine certain things together? We wanted to build Healios on a foundation of evidence-based clinical techniques within psychology. But we wanted to combine that through a channel of technology because we felt that was the right channel to help overcome this access issue we have. But also we want to make sure it's a very humanized service. So we don't want to lose this human touch to a new service. And we know when we have a talented clinician in the room, they have all these skills that they can build this therapeutic rapport and relationship with a client, how they can convey empathy and compassion in that face-to-face care. And we didn't want to lose that if we wanted to redefine how we wanted to deliver mental health services. So that was our third challenge. But our fourth was, of course, how do we wrap around those design principles, around those three elements to create this great experience. So what we developed as our first go at this was this really exciting clinical portal. And what this means is that we developed a portal that you can access from any device, and as an individual with mental health challenges and your family members connect into that clinical session And you see our clinician on your screen, and our clinician gets to see the client and the family members, and they don't have to be in the same location. We're bringing that family together through technology to ensure that everyone can be part of those clinical sessions. But not only that, is it just about video feeds and having that interactivity. We also built a really exciting space next to this video conferencing type technology, which allows us to show lots of exciting things to the client and the family, and they can interact in that space. So in essence, we recreated that blank sheet of paper which a psychologist may have in front of their client face-to-face, where they're drawing things on that blank sheet of paper, co-creating. We created that through technology, through this clinical portal. And so we decided to launch this within psychosis and schizophrenia to deliver online family intervention, which was the world's first in that space. And then over a couple of years, we expanded into other mental health conditions within the adult space. But the more that we kind of got into mental health services, the more we started to uncover a really tragic consequence of how mental health services are delivered in this country. And that is that, unfortunately, the most vulnerable in society, the children, aren't getting the support they need when they need it most. And when you kind of lift the hood on this, you actually see that, sadly, so many children in this country are sat on waiting lists just to begin their journey to access mental health services. In parts of the country, that waiting list is over a year long to start the journey, which is really unacceptable for that next generation coming through. And we felt, actually, with all the experience that we had at designing some new services for adult mental health, we had to take all that great experience, all that great learning, and we had to focus on solving the issue for children. We just had to dedicate our effort for that. And we felt motivated to do something different there. And the data supports that. The data supports why we should just focus on children's mental health in this country. Over 50% of all adult mental health conditions start before the age of 14. Over 75% start before the age of 18. If we can get this right for children's mental health, not only is it the right thing to do, but also we can have a massive impact in a few years' time on lifting the burden, perhaps, on adult mental health services. So getting this right is absolutely critical. And so this is why we decided to focus on this. And over the last few years, we've been developing some exciting solutions, expanding that clinical portal to cover many other conditions within children's mental health, not only just adults. And that means delivering online assessments, such as autism assessments, ADHD assessments, general mental health assessments, through to a range of psychological therapies, all online, so that people can access that from the comfort of home. But we need to go further than that. So once we started delivering these clinician-led services through a clinical portal, we recognized we still need to push our thinking even further. We had to create even more scalable solutions, because over the last 10 to 12 years, we're seeing a growing mountain of morbidity when it comes to children's mental health challenges in this country. Going from 1 in 10 back in 2004 to now almost 1 in 8 children, young people who have a mental health challenge in this country. So therefore we have to now think about how do we bring more scalable solutions that are not only preventive, but are early intervention to tackle this mountain of morbidity. Let's stop this growing. And so we really pushed our thinking again on how do we bring different solutions into this space. So we set about this task about creating a coach in your pocket that's available 24/7. And we set ourselves a couple of kind of directional points that we wanted to achieve. The first is that we wanted to create something that had a fairly broad age range for children. So we aimed for 11 to 17 years of age. Now that's quite a challenge in itself, because there's a lot of changes that happen in those years, and to make something that's applicable for that age range was quite a tough task. But we also wanted to make sure that this solution was about self-management as the first step. To be hugely scalable, it has to be about self-management. But at Healios, one of the things that we're absolutely keen for is that if something doesn't work and it's not right for that person and it's not helping, there should always be a next step on for them. There should never be a dead end. And so as part of the solution, we wanted to make sure that there's further escalation of support, perhaps to live connections to our clinicians, if that self-management isn't being as effective for that individual. And on top of that, we wanted to set up the bar that we wanted a solution that was preventive. So we wanted a solution that can help build resilience in young people, that can help support their general mental health and emotional well-being. But we also wanted the ability to create something that could support early signs or early symptoms of anxiety and low mood. So it had to also have an element of early intervention within it. And so to achieve that, we've decided to focus on the clinical architecture of the solution around cognitive behavioral therapy, which we know has about 60 years of evidence behind it. And we thought if we can build it on the principles of that, then we're setting ourselves up for success. So to kind of build this exciting new scalable option for young people, we decided to use all our expertise at Healios, and we've got a fantastic multidisciplinary team covering clinical experts within child psychology, our exciting tech team and so on, but also with external input as well. So we had fantastic external expert advisory group, but also, of course, co-designing with young people on this journey. So we wanted to assemble a really talented team to help us do this. And so what did we come up with? We came up with Think Ninja. And Think Ninja is an app, and it sits on your phone, an Android or iOS phone. And it's designed to achieve those things we saw a bit earlier on a couple of slides ago. It's designed to prevent, it's designed to bring early intervention. But we want it to be a really engaging solution because we're dealing with young people at the end of the day, and they're very easily distracted. There's so much happening in that social media space to keep their attention, for them to work on skills and to learn about mental health and emotional well-being. It had to be engaging. So we created a virtual assistant called the Wise Ninja, which in essence is what we've taken that clinician's brain and stuck it into the Wise Ninja as that coach that sits on the phone and is designed to support that young person in a really engaging way and help educate and deliver skills. So let's meet the Wise Ninja.
Welcome. I'm Wise Ninja, your personal guide here to support and coach you in managing your emotions and fulfilling your potential. In life, there are times when we feel great and all is well in the world. Of course, there are times when we feel life is too much to handle. It's normal to sometimes feel low, fed up, and stressed. How we pick ourselves back up and keep going is important. There are times when we feel weighed down by our worries, think we can't do something, and start to behave differently. It can happen to all of us. Things that were once easy now feel impossible. At times like these, we all need a little help. Sounds easy, right? But asking for help isn't always easy. Sometimes we may think there is no one there to help us, especially when we need it the most. That's where I come in. I'm here anytime you need me, so don't be shy. We can talk about feelings, thoughts, and together we'll work through exercises to help you feel healthier, happier, and ready to make the most out of life. We will develop ideas and skills to help manage our moods and cope with the bumps that come along in life. These new skills will stay with us forever. Let's get started, and remember, I'm here with you every step of the way.
I hope you enjoyed meeting our little friend Wise Ninja. It's very important when we step into new areas of treatment that we actually build a solid evidence base, and that's a very important thing for us at Healios. So as we speak, we're actually doing a feasibility study right now, I'll get back to that in a little while. But we also have a great plan for how we want to move forward, because we do want randomized controlled trials. And we also have lots of focus groups where we're listening both to kids, to parents, and to schools. It's very important. The feasibility study is actually the biggest UK digital mental health study in schools running at the moment. We've got 5,000 kids and it's across 7 different schools. And we're hoping to get the results in July of this year. And we've had study design support from Professor Kathy Creswell from University of Reading, and also the Thames Clinical Trial Unit. And the objective with this feasibility study is actually something that I think is very exciting as a psychiatrist. We are also trying to understand how a non-clinical population is going to respond to our app. And the hope is that we're going to build resilience so that these kids later on in life will not develop mental health problems. It's a very new approach, I think. Our other objective is, of course, also that we want to see how kids are going to respond, kids that already have problems with their anxiety and their mood, how they're going to respond. And we are using what we call validated rating scales, both in mental well-being, emotional well-being, mood, resilience, and very importantly, quality of life. For good reasons, quality of life has become a center of focus in psychiatry over the last 20 years. I don't really know what we did before, but it is, of course, what we're here for, basically, to improve quality of life. The future of psychiatry, if we get this right, is super, super exciting. We have, without too much success, been looking for biomarkers in psychiatry over the last many decades. But digital biomarkers is perhaps a way forward, so we can use data and sensors to create objective mental health measurements. And that is really, really important if we get this right. It can also support us to make better diagnosis. I think that for very good reasons, the validity of psychiatric diagnoses have often been questioned, but we're hoping with these kind of digital biomarkers and digital support that we can make better diagnosis in psychiatry, that so far they are just clinical diagnoses, all our diagnoses maybe apart from Alzheimer's. Another key word for us is prevention. We've done so little preventative work in psychiatry, it's actually shameful. And we are hoping with this new approach that we can actually strengthen and empower young people so they don't develop mental health problems further down the line. We don't have any proof for that yet, but it's likely to be the case if we actually empower these kids with useful tools at an early stage. And of course, we are also hoping to optimize care management so we can target our scarce resources and actually put them in where it matters the most. And we have some complete digital pathways, which is pretty revolutionary, actually. A couple of testimonies here. A testimony from a mother that felt it was very convenient to have this kind of service in her own home. They didn't have to go out to get family interventions on a cold Thursday evening, but they could actually receive it back at home. And she was also very impressed by the fact that it didn't have to wait. And waiting times, they're toxic for our patients, they really are. The problems often multiply while people are waiting for input. And this little girl here, she said that she felt that CBT gave her some tools, and hopefully she can remember them so she can use them at a later stage in her life. If we get this kind of stuff right here, we can hope not just to reduce cost, optimize care ways, but most importantly, to try to see if we can reduce human suffering. Thank you very much for your attention.